Nearly 3 years after the first recorded case of COVID-19 in Michigan, the state's lieutenant governor says that some of the lessons learned during the tumultuous time turned out to be good ones.
Political reporter Rick Albert is here now with more on that. Rick?
Yeah, this report came out today, and the lieutenant governor is saying he is overall very proud of the state's response to the COVID-19 pandemic. Garland Gilchrist set a task force looking into racial disparity when it comes to medical care. Access and quality is one of the reasons why. By recognizing that the rates of infection and deaths were higher by far in the black community early on, and acting set the state apart from others. The task force released their report today in Detroit. The lieutenant governor talked about some of the steps that were taken to narrow the gap in availability of health care by the end of the pandemic.
That was due to so many of the interventions that happened, not just one, but the combination. Neighborhood-based testing and vaccination sites, mobile units, differentiated communication strategies, building relationships, the grants program that funded organizations across the state of Michigan, the infrastructure that we hoped to build. When we built physical infrastructure, that was new. We built testing and isolation facilities for migrant workers in West Michigan. You know, we had to recognize that this was landing on different people differently.
The task force says the disparity in health care was something that existed prior to the pandemic, but highlighted by the disproportionate toll that COVID-19 took in the black community, prompting the state to act. Brian?